Hey everyone, welcome to Collateral Nation. It is the winter, it's the holidays, and so I am spending the holidays actually with family down in Southern California, and I'm in a hotel room, you know, getting my steps in some beautiful sunny weather and getting ready in the next few days to go back to the cold weather in the San Francisco Bay Area. And so while it's easy, I know, to get in steps in warm areas like Southern California, it's a lot more difficult in places like North Carolina, which is where my fellow colleague, Kevin Thomas Morgan, is. Kevin, how do you adapt your walking program, your workout regimen, the moment it starts getting cold?
Well, you dress up warm if the weather is not too inclement, not too much ice around, stuff like that. I use the gym. I've got a membership for a local gym forever. So I can use a treadmill and weights and all that stuff, an elliptical machine. I used to like using the rowing machine, but as I have a abdominal aortic aneurysm stent graft, that is ill-advised.
Yep.
One person actually nearly killed himself on a rowing
Oh
machine
no.
and
Yeah,
displaced the
don't do
stent.
that.
Found it on PubMed. That caused me to move over to the elliptical, which doesn't involve a lot of, hip flexion. I guess the answer is discipline. You find a way. I remember one time I went with a bunch of skiers to a lodge in the mountains, but I couldn't ski because I had an injury. And there were about 8 or 9 of them. They disappear all day, and I was stuck in this lodge on my own, and I need to work out. And there's snow outside, and it's freezing cold. So I was in a kind of high-rise building, and I found the stairwell that the engineers use. It was like 10 floors of stairs.
Oh my goodness.
Ran those stairs up and down and up and down. It was great. Kicked my ass.
That's
It
great.
was warm. And so what you do, it reminds me of a famous quote by Nietzsche. He who has a why can always overcome a how.
Yeah,
That means if you have a goal, you can always find a way to get there. So that's basically how I do it.
it's so true. We even have our friend Douglas, who is in a hospital room right now getting ready for a procedure. And I've been looking at his Facebook, and he is finding ways to get his steps in, finding ways to move, and still improve his circulation while he's actually there in the hospital bed, not just sitting
Right.
there resting on his laurels. He is actually doing something. He's up, he's moving as much as they will allow him to move, but they're not going to stop him from moving his feet around, doing the alphabet with his feet, A, B, C, D, E. Gives you really great exercise in your feet, doing some toe yoga, right? As Kevin always teaches us. Oh, Douglas, you're doing it. You want to unmute really quick and tell us what you're doing? He'll sit on the side of the bed. And for those of you who are watching on YouTube and you can't see what's going on in our live studio audience, which reminds me, you want to join the live studio audience, make sure you email info at padhelp.org. And don't forget, if you are on YouTube, subscribe to our channel. It really helps us a lot to drive our videos forward and help so many more people like Douglas. So Douglas, unmute for a second and tell us what you're doing, because I think a lot of people would find it really inspiring that you are sitting in a hospital room and you're not just sitting there watching TV.
Excuse me, one of my dogs has to pee. I'll be right back.
There's always a furry friend problem. It's good to have a furry friend because there is a study out there that shows that you do walk 22 minutes more each day if you do have a furry friend. So if you can't adopt a dog this holiday season, um, it's a good time to do so because, as Kevin just proved, they get you up out of your chair more often than not. But I want to go back to Douglas while Kevin is taking his dog out to do his due diligence. Hopefully Douglas can unmute for a second and actually tell us what he's doing. Hey, Douglas, can you unmute for a second?
Yeah, the
There
nurse
you are.
is in here. The nurse is in here right now, but I'll put my. I can handle this.
Because I haven't seen you walk yet.
She hasn't seen you walk yet, huh?
Using the walker first.
Are you using a walker to walk, Douglas?
Yes.
Yeah. He's getting up. The nurse is in his room. She's gonna help him get some more steps in. But prior to the nurse walking in the room and getting him up and moving, he was sitting on the side of the bed and he was actually just moving his back and forth and back and forth. They give you those little slippy socks that you put on. Just have those socks on. It has a little bit of traction at the bottom, but you can still go back and forth and back and forth.
I'll just walk to the end.
And so Douglas is now taking us, if you're in the in-studio audience, you can see him and the nurse in front of him with with all of his wires and tubes and everything else. And he is taking a walk down. It's actually a really beautiful hospital, beautiful wooden floors. It's really, really nice. But he's going to take a walk this morning and he's taking us on the walk, which is good no matter where you are. You can get your steps in. Just ask your nurse, ask your doctor, what are my guardrails? What are my limitations? What can I do because I have PAD? You could be in the hospital for a million different reasons. And so it's really important that you don't rest on your laurels while you're in there. If you don't use it, you're going to lose it. I see more patients, Kevin, that sit in a hospital room for maybe they have a heart cath or they have pneumonia, they have something else going on, and suddenly they end up with blood clots, not only in their veins, DVTs, but they end up with blood clots in their arteries and their leg becomes threatened. And so it just becomes this vicious cycle. So you can't just sit there in a hospital room all day long. You have to move your feet. You have to move.
I have an interesting story, Kim, that's relevant to what's going on here.
Yeah. Yeah.
I'm sorry the dogs are so active.
We love
About
active dogs.
a month ago, I was swimming, and when I pushed the pace, I got pain in my jaw, pretty severe pain in my jaw. So as a pathologist, I come up with a differential diagnosis. Why do I have pain in my jaw? And the fact I have PAD played a role in the order in which I came up with the list. My list started with stress, tension. Number 2, cardiovascular insufficiency and pain. Unilateral pain in your jaw can be a symptom. And most people with PAD end up with some kind of cardiovascular problem. I believe about 70% die of a stroke or a heart attack. So you have to watch your heart. And the third choice was possibly a tooth, but it didn't seem right. I could reproduce the pain by pushing on the masseter muscle. So first thing, was I stressed? Well, I wasn't really stressed. I was fine. So I ruled that out. So I took my pulse and it was solid as a rock. But if you have any suspicion of cardiovascular disease and is a risk with PAD, go and get checked. So I made an appointment with my physician. She checked me out, listened to my heart and all that stuff. And there appeared to be no sign of that. Third choice, a tooth. And I've had trouble with my teeth forever because I had rickets as a kid and slowly they've rotted out of my head. And that's one of the symptoms of rickets, is a vitamin deficiency. And so eventually it came down to my next to last molar being removed yesterday morning. And I've been having growing toothache for a month. And I couldn't exercise to any degree because any kind of effort induced a very, very severe pain in my lower jaw. But it turned out it wasn't the masseter muscle. It was a dental problem, and now it's gone. And so
it's amazing.
Getting the correct diagnosis. And remember, if you have PAD and any suspicion of cardiovascular insufficiency, go get checked. It could save your life. So I did. Yep. I mean, I don't like to go to doctors unless I have to. So I'm a veterinarian. But I did.
But that's what actually I think Douglas would relate to, right, Douglas? Douglas went in there for his leg. He was having problems with his leg. And while he was in there, they said, no. We need to hold off on the leg. We need to look at your heart. And so that was, it definitely exemplifies what you're talking about, Kevin.
Yeah, a friend of mine went to the same doctor. And you know what I like about this doctor? Well, number one, she took my advice. I said, you know, about a year ago, you really are overweight. You need to do something about it. And having Asperger's, I just say what I think. Sometimes people get upset and they get angry or whatever. I don't care. I say what I think. I try to be diplomatic. Anyway, I saw her about a week ago and she'd lost a lot of weight and she was looking really good. And she'd listened to what I said. And she's a great doctor. She listened. And a friend of mine went to her about 2 weeks ago and she insisted he went to the ER. And it turned out he had congestive heart failure.
Oh,
And they
no.
went to Duke and pretty well saved his life. So typical English stoic, where maybe you'll tough it out. Well, some things you'll tough it out until you're dead. It's not always a good idea. So if you have P.A.D,
Yep.
keep an eye on your heart. Just you don't have to be worrying about it. It's a waste of damn time. In fact, worrying about your heart will give you heart disease. So don't do that.
Yes, that stress. We just talked about it on our YouTube channel, youtube.com/the @ the way to my heart. Subscribe to it because
Man,
we have nurse practitioner Deidre who's on there, and she talked about how stress, the mechanism of action by which stress actually leads to plaque buildup in your arteries. And it was a really interesting discussion. So worrying is not good for heart disease
you
at
see
all.
Doug's troponin, 900 to 1,000, pretty high.
That Douglas, that is really high. And I'm
Yeah.
glad. So there are quite a few different doctors that treat PAD. You have, of course, the vascular surgeon, you have interventional cardiologists, you have interventional radiologists, you have vascular medicine doctors, and we're seeing more and more of cardiothoracic surgeons that are becoming more interested, not just in the heart, but in endovascular procedures, not just the open procedures, which is the foundation of their training, but they're doing more and more endovascular in the heart. And they realize that their patients also have leg issues, and if they can take the wire and the balloon around the, tortuous, areas of the heart, the twists and turns and navigate the wire there, why
Wait,
not do the legs, right? It's a straight shot. And
wait.
so we've seen quite a few cardiothoracic surgeons actually expand their practice to legs. And for Douglas in particular, he's had some heart things going on. And, in having a choice as to whether we send him to interventional radiologist, a vascular surgeon, or a cardiothoracic surgeon, we decided to send him to a cardiothoracic surgeon. And he actually made the choice himself. He has a few different options. And I mean, Houston is filled with critical limb ischemia operators or CLI operators, advanced skilled PAD doctors. And he chose this one, and I'm so glad he did, because there are some doctors that are very myopic that will say, I'm here to treat your legs, and they don't look at anything else. And for his doctor said, you know what, we could treat your legs, but I think we need to treat your heart first. And he was able to take a holistic approach to Douglas's care. So we're just praying it all goes well. And he's sitting there. What do you think, Kevin, about his exercises that he's doing?
I like the way he's
Look at his,
rotating his ankles. That really is a good idea because it uses all the different muscles in the calf and up in your hips if you're relaxed. So that was good. I don't know how much he's spreading his toes, but he looks like he's spreading them. It's hard to see in the socks. But yeah, no, he's doing a good job.
he's taking off the sock for you now.
Oh, yes, pretty good. Oh, he can spread his toe. Oh, man, that's really good.
Really good.
Spreading those toes is really important because it separates the metatarsals. Only a little bit, but enough to reduce pressure on the arteries and, connective tissue between those bones, and allows refill. And then, of course, you pump the blood out by contracting and flexing your foot. That's how the P.A.D. 100 works. Yeah, I think people tell me more and more it helps. So that's good to know.
And he's up on his toes. He's going down on his heels. Is he doing that right? Is that a good idea?
Well, what
He's
he's
doing
doing,
quite a
yeah,
variety.
he's contracting the muscles in his calves and on the bottom of his feet. And that anything to keep moving and keep your strength is good. And everybody's body's different. You have to find your weak spots and work on them, basically. And turn your feet
And then
into pumps. You got to use your feet as pumps. They pump blood.
yeah, yep. Oh, look at that. He just picked up his sock with his toes. Did you see that?
I saw that. That's how
So
they learn to
he,
flex your toes. And
oh my gosh, that's incredible.
that contracts muscles in your calves, which pumps blood back to your heart, improves venous return. So yeah, Doug's doing a good job.
And it's a variety of things. It keeps him, you know, I mean, what are you going to do? Sit there? It's so boring to sit there in a hospital. But I love that he, I mean, you talked about before just picking up a towel with your toes and even just the motion of pretending you're going to pick it up. And if you're laying in the hotel bed, in the hospital bed, it started with an H, you can even try to pick up the sheet from the bed and just go through the motions, even if you can't pick it up, just go through the motions of pretending to pick it up. But he's going back and forth, so I'll show you just so people know what he's doing. He's, you know, going back and forth here. He's picking up the sock with his that he took off the ground. He's doing ankle rotations. He's painting the alphabet, you know, with his feet. He's doing the pad 100, which Kevin always says I don't quite do right, but the key is you want to spread your toes and get some flexion in there, I think. And yoga toes, spread them, you know, bring them out, bring them in, spread those toes, bring them under, bring them back. Moving things around is really important. He's also going up on his tippy toes, you know, and back down on his heels. So he's getting a really good variety in there while he's sitting in the hospital and waiting for a procedure. So there's so much that you can do. And also, if you're just laying in bed, it's important for to ask the doctor about those circulation socks and to make sure that you have those on. So that's really important as well because you want to prevent not only blood clots in your arteries, but also you want to prevent deep vein thrombosis or blood clots in your veins as well, right, Kevin?
Yep, just have to watch out for compression with P.A.D. But acutely in the hospital is totally different to general life. I mean, it's like, for instance, I'm always against statins, but they do have their place, and beta blockers have their place after heart surgery. They don't have their place in daily life, and that's the difference. And it's true of these kind of things. It's very different to an acute situation where you're stuck in a bed for 2 days or more
Yeah.
to living your general life. So good idea to listen to what your physicians have to say about avoiding a DVT, because that can be pretty well lethal. Same on
Yeah. It's
airplane.
And you can't assume that the doctors are going to know. You have to, sometimes they have a lot to have to remember. They have a lot they're doing. So you have to remind them that you do have PAD and to see what sort of modifications that they can make to help you improve your circulation while you're in there, to not be just sitting there sedentary and leaving your legs to just wither away. You've got to talk to them about moving. Sometimes they'll even bring in a physical therapist in the meantime for a couple of sessions. So it's worth asking. I mean, if you don't ask, you don't get. So why
Yeah,
not
be the
just at
squeaky
least
wheel
ask?
in the hospital.
Yeah.
It pays to be the squeaky wheel. It really does. Not in an irritating way, but you know what I mean, Kim.
Yep. You know, another thing that I always tell people is if you know someone that's in the hospital or you know you're going in, to make sure to bring in some, you know, big, you know, I always say bring in the 32-ounce water bottles and bring in 6 of them so that you know how much you're drinking each day, depending on how much your doctor allows you. Because if you have chronic kidney disease or end stage renal disease, of course, your needs for water are going to be different than an average person. But you're never in that little container that you get from the nurse. You're never going to get a good amount of hydration in, you know, if you don't have the IV going. Even with the IV, ask them, how much water can I be consuming each day? And usually it's one of those containers of water that can really help you because it also makes sure that you're getting up out of bed more often than not to move to use the restroom. So, you know, see if it's possible to bring in, you know, those big water bottles, and then you know how much you're drinking, and you're more likely to drink more versus less to stay hydrated.
Just staying hydrated becomes increasingly important as you get older. And I find that on airplanes, which I don't go on so much now, and in hospitals, places like that that are heavily air conditioned, they dehydrate you. And so you do need to drink a bit more. But I'm just wondering about Marina's statin adventure.
Marina, Marina, you want to give us an update? You're actually, you had some issues with the statins, and you're now, I think, into your second month of
Third month.
your supervised exercise therapy program.
I'm in week 7. No, week 8. Week 8 of 12. So almost done. I unfortunately am not seeing much progress over the last 2 weeks, which is very discouraging for me. As far as the statins, my legs feel better. They definitely feel better. I go back to my doctor next week and talk about if I should go back on anything. But I don't have as much pain in my legs. My legs are not as tired. So it's good. That was a wonderful recommendation for me, Kevin. Thank you.
Yeah,
So,
what your doctor says with a pinch of salt, for heaven's sake.
Yep.
This is
so
your body, and that's what you're doing. And by the way, because you didn't have much progress for 2 weeks in this game, it is an endurance sport. It's definitely a marathon, and you don't let that discourage you because you're making progress you're not aware of. So you keep pushing forward, and then all of a sudden you have a good day, and then suddenly you realize you've made progress of which you were unaware, because we have our hopes, right? And we get our hopes up. And I mean, I've done so many Ironman races and marathons and stuff like that and trained for them. And I would sometimes feel like I was getting nowhere. And then all of a sudden I'd notice I had made some progress. It's just, the stress of life, or my expectations are unreasonable, or I had a cold and it was, slowed me down. So don't worry about 2 weeks. Think more in terms of months, or not like the Catholic Church who thinks in terms of centuries. I got that from the Spotlight movie. That quote made me laugh. About right too. But you got to think in terms of months, not days and weeks with P.A.D.
Yeah.
And Marina, are you feeling overall in your daily, lifestyle, are you feeling like you're improving or have improved since you started, even if you feel like you plateaued?
I guess yes. When I take our dog to the tennis courts to play with him there, I don't have to sit as often. That I've noticed.
Oh, good.
So that's good. The other day I was at our grocery store and I didn't sit once. So that was good. Before I get to the deli area and have to sit while eating some deli. No.
This is big progress. That's real progress.
Yeah.
You're
It's
going to
just,
get a lipid profile run sometime?
I'm sorry?
You're going to get a lipid profile run? For your blood lipids, for cholesterol, LDL, and all that stuff?
I go to that doctor next week, and then in 2 weeks I go back to my vascular and hopefully get new ABIs, and hopefully hopefully there'll be some improvement there.
Well, tell us what the situation is, and if we can advise you, we will.
Yeah,
I'm
I'm definitely going to need advice.
you have to listen to your doctor. Kim has to tell you that.
Yeah, I hope I go back to the doctor and he says, keep at it. Everything looks good. You're improving. If there's any difference in what he's saying, what I want to hear, I'll definitely speak with Kim about a second opinion.
Okay.
Yeah, we have plenty of second opinions, and even within her system, she has some great ones, as you know, over in that area. It's so many universities. You have PhDs and coming out of your ears, and MDs. So you got lots and lots of options there. An interesting discussion, though, that I shared with Kevin, and I'm not sure, Marina, if you saw it on our youtube.com/the outside the way to my heart channel this week. We have a series called Next Gen Med, and it's with Dr. Lily Johnston. She's a vascular surgeon, but she's really progressive, and she's all about metabolic health. And while she is, going to follow protocols and the evidence and the standards, which say that you have to be on a statin if you have peripheral artery disease, she goes a step further and she personalizes it for every single person that comes to her. Because, for example, with my dad, we had this discussion that for him, a statin wasn't appropriate because he didn't have a liver production problem. He had a cholesterol reabsorption problem, and that literally was the issue. And while he started off on a statin just to start to get, him in check, and he was going on vacation, didn't want to worry about the foods and stuff he was eating. When he got back, we made a dramatic shift in his lifestyle. Number one, we figured out what was causing the damage to his arteries, which was leading to the inflammation in his arteries. And for him, it was the MTHFR mutation. And that's like nails on your artery walls. I don't want to go into the details unless people want me to tell you why. But then also the cholesterol reabsorption issue. His liver wasn't, it wasn't that it was producing too much. It was just that his body wasn't excreting the LDLs as quickly as they should. So they were recirculating. I love this: reduce, reuse, recycle. So it was the body was just recycling everything, is the way that Lily Johnston was explaining it. So we talked about the use of fiber and plant sterols, because there is an organization called Step One Foods that says that it has done a study with Mayo Clinic, which shows that their foods can reduce cholesterol. I think it was, maybe our producer Josh remembers the number, but I think it was between 9 and 15%. So it took a good chunk for people who have really high cholesterol. It didn't make as much of a difference, but at least it was helping quite a bit. So I'm curious what your experience is, Kevin, with the plant sterols and fiber, and how you make sure you get enough of those, so that men should have 2 to 3 bowel movements a day, women 1 to 2 bowel movements a day. And it's important. It's a huge part of reducing your cholesterol.
There was a study run on bowel movements, and it was quite interesting. It turned out that white men tend to go poop more often, and black women poop less often. And it was kind of an interesting study. There was another one about how long animals urinate. In terms from elephants to mice, it's about 30 seconds. In terms of I live on a plant-based diet. I haven't kept up with the literature on that, but what you're talking about is the enterohepatic cycle. And so you will absorb stuff in your gut that goes back to the liver, and it goes around and around, coming out in the bile back into the duodenum via the sphincter of Oddi, which I always thought was an interesting name. And so I would say I haven't kept up with that. I'm too busy trying to learn how to make audiobooks. The plant-based diet is definitely a good way to go. I mean, I supplement with eggs. I do have a little cheese, but not much. But it's mainly plant-based food, and I'm not dead yet, but that's just anecdotal data. So I think everyone's different, and so the trick is to see what works for you. I mean, I don't know, maybe you start eating some plant, and then I've got friends who can't eat bread. They can't eat any starchy food at all, and others who are fine with it. I mean, I went 100% vegan, and after 3 years started developing nosebleeds. And I know friends who've been completely vegan for 20, 30 years, no problem. So clearly there's a difference. So read the literature where you can, ask nutritionists where you can, but listen to your body and see how you respond. That is the ultimate arbiter of your diet. Hi, Carl.
Hi, Carl. It's good to see you. How are you doing? How's
Hello,
your
everybody.
exercise program? And Carl, have you seen the doctor that we talked about yet?
Yeah, Greg.
Yeah.
Greg, what's his last name?
Anyway,
Anyway, at Swedish in Seattle. Yeah.
Yep.
I actually, it was a delightful day in general. I had to take a trip into Seattle, but it was I would say it was delightful to see him. And the reason, may I say some of the reasons? I had like really worked on my questions. Like I could tell, there were things that I didn't understand or get resolved from he was a second opinion from the first vascular surgeon. And so I got him down on paper, and I went in with, probably 20 kind of bullet points. Of course, a lot of them fell into sentences. So like, 20 became 7, but it was me gathering my thought, like writing, kind of getting it out on paper and stuff.
Yeah, it's a good
And
idea.
he was, well, first, I didn't know this until afterwards, but he is the head of vascular surgery,
Yep.
and also a P.A.D in the relationship to the rest of training in the hospital, and how departments work with patients. So it turned out he had a great manner, which is always nice. He was really listening, and yeah, and so I mean, he would listen to my questions and he'd go, "That's a really good question."
Yay, go Carl!
He goes, "I got to think
Go
about that for a
Carl!
second." So, consequently, I mean, I left feeling like, okay, I understand what's going on as best as I can inside of my body at this point. One of the questions that I had was, if I have carotid or cardio issues, or whatever, if I had more of these blocked arteries in my body, would the treatment that you gave me now, given that I can walk, that I can do things, that I swim, that I'm okay, other than some pain, would the treatment be any different? And he said, no, you're on the treatment that we would use for all of those conditions. And then of course we would watch, but so he really relieved a lot of the, I came out of my first vascular appointment with a different person, not exactly feeling dismissed, but pretty close to it. It was like she knew what she wanted to find out, and it didn't really matter if I understood what she was finding out. And then as far as she was concerned, I didn't need to come back unless things got much worse. And that's that.
Can we talk about that for just a second? Because we
Yeah,
hear that, and it is the standard. It's you're fine now, but if things get worse, and people are like, oh my God, it can get worse. But what do I do? Oh, just keep walking. But what does that mean for a
right.
patient? What do you need to hear? Because obviously, in this follow-up appointment, you're in the same situation, you're getting the same treatment, but there was a different conversation to be had. There was different information that was relayed to you that made you be able to go, okay, I'm going to be fine.
Some of it was just actually a corroboration that what the previous doctor did to examine me was okay. It wasn't really wrong. Like when I went in, I mean, it was clear. I mean, I had 100% match on P.A.D symptoms when my primary care physician sent me to the first vascular surgeon. And when she did a workup in the when I was in the exam room, she listened to with the stethoscope, to the places that you'd want to know about, like my carotids and my heart and maybe my iliacs and my aorta. She
Yeah,
put her
did they do
stethoscope.
did she, so we call it chat, CHAT, check, the carotids. H is for heart, A is for abdomen, and that could be for aneurysm. It could be checking, some of the other organs. It could be checking for what we call a BRUIT. BRUIT is how it's spelled, the turbulent blood flow. And then checking T for checking the toes.
Uh, the only thing I remember about the toes is I think like a temperature, kind of like
Yep.
do I have temperature, and what is it? And I think she did palpate like around my iliacs. So and she listened to the carotids. I don't think she did anything else there, but there wasn't any information before I went in that would be the standard of examination given that I already had an ABI that was positive and that,
Mhm.
you know, that required care. So to me, you know, I had had ultrasound, carotid ultrasound, carotid Doppler years and years and years ago. And I thought, well, I had that years ago because the doctor thought my cholesterol was too high, probably for too long. So why wouldn't they do that now when I already have a known blockage in an artery and kind of check it out? So, you know, that was partially me maybe knowing too much, if that can be the case, and not really knowing how they would respond to that if they took that into account. So there's kind of a lot of room for leaving with maybe at least as many questions, but they're different ones from
Yeah.
the exam as when I came in. And like I said, you know, that may be the standard of care. Well, you say it is vague. It's vague, you know, if it gets a lot worse. Well,
Right. But Dr. Greg left you feeling fairly comfortable. Your second
very
opinion.
comfortable. Yeah, really comfortable. I don't have my questions are probably somewhere here on my horizontal filing system. But yeah, and one question that I raised with him was and Kevin, you've addressed this, maybe all of it, maybe some of it, but I still needed it kind of in my own words, which is like there's the threshold of walking with no pain, which, you know, for me meant really slow, really small distances. And then there's a threshold of I've been walking hard, I'm trying to ignore the pain. I'm starting to stumble and I'm twisting my ankle because my gait has collapsed and my spine is starting to hurt. And, you know, so like, okay, so then the general thing is like, you know, keep it at a 4. I don't know what a 4 is because I am capable of taking it to kind of like, I'm going to break my body down pain.
Yeah,
And
I defined a 4 for my 0 to 5. I think I put that on my website.
yeah, no, 5, you know, yeah, 1 to 5, keep it at a
Yeah,
4.
5 is where you're getting dysfunction. A 4 is where you're getting pretty severe pain, but not dysfunction. And that's where I would try and hold it for endurance. Intensity, I take it to a 5, and then I sense dysfunction, I'd stop, refill, back down to a 2 and back up. But that's just me. That's the system I developed, I guess.
So again, it raises an interesting question for me because with the distances that you're capable of going with the Ironman and the half marathons and stuff, it's clear. I would guess that you're capable of taking your heart rate into a zone somewhere like between 120 and 140 and probably holding it, unless you're so fit that, you know, your heart stays low even when you're going vast distances. I now know that when I'm walking, if I get above 90, it's rare. And that could be going up hills or whatever. I can't pace any faster because if I pace faster, then my claudication gets pretty severe almost instantaneously. I mean, I could pace myself and I could get 2 blocks by going hard. And then maybe that's what you mean by intensity. But I don't think even in 2 blocks, my heart's not going to come up.
No,
So,
Carl, it's important. I haven't talked about this very much. When I did not have symptoms of P.A.D, a lot of my training was based on heart rate and perceived effort. Once I got P.A.D, there's no damn way I can get my heart rate up without my claudication falling apart.
Yeah.
Or the only way I can get my true cardio training is on the bike and on the swim. And there I can really push it. And so to me, that's really important. But with such severe blockages in my lower legs, I mean, 100% popliteal block with no pedal pulse is pretty bad. So now the battle I fight is how in a half Ironman can I come in under 8:30? I mean, I feel like full Ironman is slipping out of my grasp, but half Ironman, if I pull it in under 8:30, and in my age group, there's so few people, I can qualify for Worlds and keep going. But I have to come in. So I'm going to do White Lake in May. I'll train for that. I spend a lot of time trying to work out how to get my pace up without my my walk and my run falling apart. And that is the problem with P.A.D. athleticism. If I can get in under 8:30 in White Lake, I'll sign up for Wilmington, which is a qualifier for Worlds, which the following year will be in France. And I love going to France, money or no money. And so, yeah, you're describing exactly the problem. You cannot, with PAD, severe PAD, get cardiovascular training on the road. You can't. You just can't get your heart rate up enough without your stride falling apart. So you have to cross train. And for me, fortunately, you know, I swim and I'm used to distance swimming and I'm used to long distance biking. I mean, I used to do 100-mile rides for kind of basically nothing at all. And so I can get there without too much effort. Not if I have toothache, because that was how I diagnosed my bad tooth, which I had out yesterday. Anyway, yeah, it's you have to find a way to cardiovascular train, but you can't do it on your legs.
Right.
You can't.
Well,
Didn't you
so
say you just got one of those ski machines? What do you
yes,
call those?
Nordic Track,
Nordic Track.
the
Old
cross
school.
country, the cross country machine. So I had actually spent decades on it a long time ago, and then things happened and it went away, and but one just came to me, yeah, and so I can get this is the first time in ages, but I can actually control my claudication, which I get because I have weight on my feet, but I'm not heel striking, so to speak. It's much, you know, with the cross country stride, the front leg is the landing leg, and so yeah, I've been able to get my pulse up to like, now it's going to be like, my heart is so not used to really pumping that it talks to me. So
Yeah.
but I can get it up, you know, I can be kind of
I love that.
working hard and comfortable at like 118. So I am actually getting, and that happening while my leg is bearing weight. So that's a first in a long time.
It's like the elliptical, Carl. You're eliminating the impact stress, and it's the impact that triggers the claudication. And so I can have a really hard workout on an elliptical machine because there's zero impact. And so you're pretty close to that with the ski de fond. I mean, there's a little bit of impact, but there's pretty well zero on an elliptical if you use the right machine.
Right.
So that impact stress is one of the first things I worked on when I discovered my PAD back in 2014. And that impact is really a big part of the problem, including when you walk. And this is why I focus so much on low impact walking and running, because that reduces the risk of claudication. And so you can actually go further. But it's quite an art to walk or run with minimal impact. I think it's impossible to get zero impact. If I could get that, I could really move. So what you're doing is the right thing, except I hated ski de fond. I mean, cross-country skiing.
Yeah.
Couldn't stand it.
Fun though. It's a hard work, but it's fun.
Oh, it's a pain in the ass.
It's a pain in every part of your body.
Well,
It's a lot of work.
You're stuck in a track. I mean, you're stuck in a track following other people. Downhill, you can do moguls and all that stuff. It's like, one is free and the other is a prisoner of the damn ski. But, you know, it's these two tracks you follow. Anyway, Carl thinks that's funny.
Well, when I first learned how to cross country ski, it was because I had an alpine accident that took me out of racing, and I was on crutches for 3 months, and so I started going out with the Nordic team, and you know, I couldn't keep up, but I could learn. So that was a good learning. And then my girlfriend liked cross country skiing, so I got to follow her.
Right. Oh, that's not a bad thing. Yeah, but you're out there in the snow and the scenery. I mean, I missed that. I mean, I had a
Yeah.
knee injury from skiing, and that was the end of that. I mean, I really broke my knee, and so I really missed it. It's just the cold air and the slopes,
Right.
mountains, and there's no other way to see it than going down, the slopes. But you can't
Yeah.
have everything. But what you're doing,
Yeah.
I think the cross country skiing, if you like Nordic skiing, then great. You can get a cardiovascular workout without having to go in the swimming pool, or how are you going to ride a bike out in the mountains with the snow? So
Right.
now
Yeah.
most people don't want to sit on a trainer bike. I mean, I used to
Mhm.
sit on it for 6 hours with no music, didn't notice, but that's an advantage of Asperger's. That's all.
Mm.
Yeah, you've discovered something really good.
Well, I'll see how it keeps up. It's great. I can aim it out the window and look. I can actually see scenery, so I'm lucky.
Yeah.
Right.
So
I-
Dr. Hayes was pretty happy with where you're at. Do you have any follow-up, anything you're doing next? Or
He
just
said, see
keep
me
on
in
keeping
6
on?
months. He said, come back in
Okay.
6 months. Yeah. The one other sort of twist on that question about the zone that we were just talking about too, is I asked him if it would be more advantageous to be able to go longer distances without stopping with minor claudication versus pushing it and having to stop, pushing it and having to stop in segments. And he thought that for me it would be better to go the longer distances and keep the continuity. And so I've been working with that. And so two things. One is my son for my birthday sent me a watch that can track this stuff. And
Happy birthday.
so the first time I walked with the watch, I found out I'd been going 2.6 miles, not 2. And so that felt like a freebie, and really sweet to know that. And the next thing is that I've been trying that. I've been trying to kind of keep the smooth walking, the non-impact as much as I can do, and keep the claudication happening, but at the lower side. And suddenly it's like I can walk the whole 1.6 miles to my turnaround. I need to rest at that point. At that point, there's some severe fatigue, but it's oxygenation because it clears up when I give it a few minutes and I can go again. So it's been great, and I am still walking backwards quite a bit. I've become the entertainment part of town.
So you're walking
roll
backwards
their
to
windows.
Christmas. That's what we say in England.
What is it?
Walking backwards to Christmas. My God, what a funny expression that is. Just a comment on what your doctor said about distance or endurance. I
Yeah.
mean, that's why I put those graphs on my website. You're really doing marathon training for your blood vessels. And so I think maybe once a week you should do a short intensity workout and then the rest endurance, because I mean, that's how I train for marathons. You do a certain amount of intensity, but very limited, usually only once a week. And that will slowly increase your pace, very slowly, almost imperceptibly, but it does. And the rest of the time, it's kind of endurance pace where you're holding it between a 3 and a 4 for a long time. And only you can decide what a 3 and a 4 are, but you can tell the fact when you have dysfunction. If there's the slightest sign, like your foot, I hear your foot slap on the ground, you have dysfunction and you immediately back off. Immediately back off. And that's the trick. That's how I did it. So that's how I did those two graphs on the website with data from the watch. And you can see the watch data on those graphs tell me my cadence, my pace, when I had to stop, when I kept going again. What it didn't tell you was that when I used intensity, it kicked my ass. And at the end of the 5K, I had to stop. I was exhausted. And when I did endurance, I could have done another 5K. It was like, I was in the zone. but it's not a zone that's going to get you to win the Boston Marathon. That's for sure.
No.
And the website for those that are listening is inspirationalselfhelpbooks.com.
Yeah, and the page is Keep Your Feet.
Yeah.
And we
Well,
have
that was
Rob
an
that's actually tuning in on YouTube, and I'm not sure at what point he was commenting, but hey, I think this can go anywhere. He's like, now the tiger sound. Arr." Um, he's joking. I mean, you sometimes you need to growl through the claudication pain to just keep on persevering, keep on keeping on. He said that the compression socks have helped him just a little bit, but if you're an advanced stage PAD, probably not the best idea. Good to talk to your doctor. But there are some people that have both PAD and chronic venous insufficiency. So we call it peripheral vascular disease. And for some of those patients, sometimes a little light compression can help with the swelling. So there are some patients that we've had advised that when they go out and they're walking, just to wear a little light compression, even with PAD. So, and he says,
venous insufficiency, you really are advised to do that. But like you say,
yeah,
very light, not enough to compress the arteries, enough to help the veins.
because people don't realize that down toward the distal end of your calf, there isn't a bone to protect, between, the outside and your arteries. So up above, up towards the proximal end of your calf, there's a bone, right? That can, your arteries are in between, but below everything can get a little squished. So you have to be very careful.
Yeah, know your anatomy. That's always a good
Yep.
idea. And your physiology, that's always a good idea. And the biochemistry and your mathematics and your physics. How are you, Mike?
Hi guys, sorry I'm a bit quiet. I'm
That's
not doing
okay.
too good at the minute, to be
Quiet,
honest. That's right.
Yeah, what's going on, Mike?
I'm just feeling like I'm falling back into depression a little bit and can't seem to find a way out of it again. So
Okay, how can we help? Well, I have to say that just half the battle is just even being here and just showing up, whether you're quiet or not. Just being here shows, and this is what we always say, you can be in your own little poopy corner with your own little poopy face, like we all have it. I'm not feeling that great today either. And you show up, right? And even if
yeah,
you aren't feeling good in this moment, just showing up shows that you prefer to feel better, right? And preferring to feel better is a huge step, and it's a huge indication that you will get to where you want to be, and that it's okay to be where you are right now, because you're going to get to where you want to be. You're willing to take the steps to get out, even if you're just embracing where you are right now.
And you
yeah,
may be coming down from the 13K because that was so exciting and you did a great job. And you could be coming down. I know that feeling after you've done a race. There's a period when you feel, I don't know, you just feel down because it's over now and all the excitement's done. And then you have to think about building for the next one. And that's how I deal with it. It's like I pick a race and sign up, which might be 6 months or a year away. And then I'm back on track. But it's, yeah, depression is a funny thing. It's,
I'm still getting up. It's like this morning I got up. I've done my treadmill this morning. I've done 100 minutes on it.
Oh, wow.
I'm throwing in 2-minute runs in running intervals on it now. I'm hardly getting any claudication, but this thing with this new Raynaud's apparently it's really taking its toll. A couple of Wednesdays ago, my big toe on my right foot, which isn't even my pad leg apparently, the tips of my big toe went white. But it's like ever since I got in a warm shower and I got the blood circulation back to it. I put a SATS probe on and the SATS was only 75. So I got in a warm shower and warmed it up and did what I was supposed to. But ever since, it just feels like I've got a pin sticking in the end of my big toe, like I've done a little bit of damage to it, so to speak.
yeah, severe Raynaud's can do that. I knew you lost the skin off the back of my hand one time with Raynaud's. I mean, I've had it pretty bad for about 30 years. I think it's totally unrelated to PAD. It's a neural reflex that's causing vasoconstriction. And it's a really weird condition because I've noticed I can go out in freezing cold weather and my hands are fine. And then I can reach into the fridge for for something in the fridge and trigger Raynaud's. It's like a neural reflex. And so I think if you have that, keep those foot warmers handy, keep those shoes warm in the cold weather, and you can keep it completely at bay. But if you let them get cold, it'll trigger it, and it can do damage, minor damage or severe damage if you're not careful. But yeah, that's, ever since then I've had hand and foot warmers handy if I know I'm heading for cold conditions.
Yeah.
That's
I've just put an order in for some more foot warmers and some hand warmers. I've got some hand warmers anyway.
And you said it was in your non-P.A.D foot, right?
Yeah, well, I've only got as far because I've only had an ultrasound scan on my left leg. They didn't go into my right leg because my ABI was it was in range, so they didn't think that it was worth scanning my right leg at the time. But we've had we've had a nor'easter snow dump on us, and the temperature has dropped. It's like -9, -10, and I'm just so worried about even going out.
Well, there is a solution, Mike. You can move to Florida.
Well,
down
yeah.
there, you'll have other problems down there. Anyway, just make sure you just keep your extremities warm. That's the trick. And also keep your core warm. Make sure you have a warm core, because I think that also plays a role. Yeah. So anyway, hang in there, Mike. We're on your side. No one asked. I want to ask Diana or Pale how she's doing, because I noticed she's been sitting there quietly, and she had a whole lot of things going on. I didn't mean to cut you off, Mike.
Yeah, hi. Sorry, I joined a little bit late. I'm trying to do some of the flexes that you had on the video that you have put on, but I'm also trying to do some of the YouTube they're dance videos, like beginner dance videos, but very like I don't go the same pace as they do. So I try to do that, and the claudication pain I think is coming on so much sooner that a lower threshold, even like lower levels of activity will trigger it.
Yeah, well,
So
it is a constant battle, and it's like an endurance race. So you're fighting back, you're doing what you can, and then you'll find certain activities, it really is hard, especially if there's impact. And so you have to be judicious about the exercises you do, and find what really works, and get a level of claudication that isn't crippling, so you can keep going and keep growing collaterals. That's the trick. But you have other stuff going on, if I remember rightly, that's kind of limiting some of your movement. Is that correct?
yeah, that's right. So I also, with my toes and everything, I think even when I shower, I have to try to keep it dry. And so the pain around my toes, and because of that, the shoes that I can wear also come into play. And what I found with these YouTube videos was that I do it at home with slides on. So I can't do it with shoes on, but I try it with slides on. So I can't do the high impact one, of course. I just kind of walk along the way they're dancing.
And how is your mood about all this stuff? You doing okay?
I have my ups and downs.
Yeah.
Yeah. I think on the days that are tougher, are the days that are tougher for me. But I do try to push myself, just trying to get as many steps in, and I try to I see that when I try to start getting the steps in earlier in the morning, I get a little bit more encouraged to get to a higher number of steps. Whereas, if I'm not able to walk in or get the steps in the morning, it's much harder for me to get motivated later in the day.
Did you have a support crew, friends, family?
No, it's just you guys.
It's me. She can call me anytime.
You were
And
developing.
she
yeah.
has a world-renowned doctor that's also weekly with her too. So
It does help to, you know, to
we're all
develop a
family.
local network of friends and stuff like that. I know some
Mhm.
people find that difficult to do. But I think it is important if you can. And as we get older, it's easy to become isolated. And so I think making friends with younger people can be good.
Yeah.
It doesn't have to be about movement and running and walking. It's just feeling like you have a network of support. This is really helpful. I mean, when I got into this, first of all, I found I was working on my own all the time. And here I feel that my efforts are promoted, which is really good. So you're doing the right thing.
Yep.
Do I call you
And
Pale or Diana?
Probably Diana is easier. But it's Ballet. But it's okay. Diana's fine. All my friends call me Diana. It's my Burmese friends who call me Ballet.
I like Pale. Pale is good. That's how I
You
first
can
saw
call
you.
me that.
I saw you online or something, somewhere. I don't know where we communicated by text or messenger.
Yeah.
Facebook, yeah.
Yeah. Well, this is a good thing, that their support. I get this feeling
And
that Marina is packing up.
what?
I saw her just putting stuff away, and I thought she was about to leave. So, but anyway,
Yeah. Well, we
I'm
wrap
really
up,
glad.
about an hour in.
Um,
We have our hangout later today as well. And we're actually going to be joined. I hope all of you can join us. We're going to be joined by Dr. John Phillips. He's going to be joining us. And we want to talk in tonight's hangout. It's at 7 p.m. Eastern time, 4 p.m. Pacific. We're going to talk about, I don't know what we're going to talk about, actually. We just want to hear what everyone has to say, what's on everyone's minds. I think it would be interesting after this conversation this morning to maybe just share how it is over the holidays, having PAD and trying to keep up with family and the feeling I think a lot of times over the holidays of a little bit more isolation, even if you do have family around, because there's so much that family does not understand about PAD. I think that there's a lot that doctors don't understand about PAD. I think Carl, talked about that earlier because some doctors can be very dismissive and not really understand how this really weighs on you, how pushing through the claudication is not as easy as they may think it is because they don't know uh, what it's like to be on the verge of immobility, and that is even a psychological demon. Even if
well,
you are walking
in the
right now, it's
holidays,
still a demon.
Christmas and the holidays is always hard for everybody. It's like the hardest thing
Yeah.
to get through. But the trick is, if you feel down, like Mike is feeling down, spring is on the way after that, and the snow will melt and the ice will go away, and then
Yep.
we'll have another springtime. You just have to tough it out. Imagine those people living on the prairies in those mud houses dug into the ground. How the
Ay,
hell?
ay, ay.
I read a book about that called Giants in the Earth, and it was like, my God, those people, they were all Swedes, I think, and what they went through, and they must have loved it when the spring came around. Hi, Dad. And
Yes, my dad. We're on vacation, so
to make friends, get a network, make sure you have support. This is a good place to start, but real people are even better.
yep. But it's we'll all get through. It's just a few months, and we're always here. Make sure you join us every single week right here for our Collateral Nation. We'll help you get through the winter. We know it's not as easy. We
Oh,
know that
Donna,
there are situations with Raynaud's. I have
Marina has my
Raynaud's even.
present. I filled Marina with my present.
What?
I thought
Thank
she
you.
had my present in a box. She was trying to hide it.
Oh, do I get one too, Marina? Or is it just for Kevin?
No,
Just
this
for
was
Kevin.
a gift I just received.
Oh,
It's a
we
broom, by the
thought you
way.
were. It's
Nothing-
what?
It's a broom, nothing exciting.
By the way, I should
It's-
tell you something that's interested me a lot, which I think is worth knowing, and that is to go in and find out where you are on the AQ spectrum. I've written a book about it. I just made an audio about it. I'm not asking you to buy my book or anything like that, but the spectrum has two ends, and if you know where you are on that spectrum, it can actually help you deal with life. The test is simple, 50 tests. If you go to my website, and it's a page called Passion versus Reason, and in there you'll find, I think they're pretty sure there's a link to the test. You do these 50 questions, and it's a really solid test. I ran an experiment. I plotted out the data on my website, and there's definitely a shift towards the left or the high emotional end. The people where I live, right on the far end of the right, towards the autism end, we're just slightly different to those people, but we're all on there somewhere. And knowing what it is, what your score is, it's kind of helpful because it gives you some idea, a little bit more information about who you are and how you react. And it helps you understand the people who are in a different place on the spectrum. So that research kind of interested me a lot. It was quite fascinating. And I tried to correlate people's scores with their passion, with what they like to do or their jobs. So anyway, I'm just mentioning it's there because in the winter, you have a time to reflect and think about yourself. And as Socrates said, it's a wise person who knows himself. And that's just one way of, knowing a little bit more about yourself, what your score is. So, because it will affect how you handle life. Help me anyway, because I had no idea I was that weird.
Can I share something, Mike? Hey, I do swim right now, which is just to say that I'm in the water for like 40 minutes and I get pretty chilled. So I always deal with this when winter is coming, but every year further on, my metabolism is a little bit less robust. And I'm really struggling. And what because I walk like a half a mile from where I swim back to my apartment. And last time I swam, I was really chilled, and I pulled up my stuff like this, and it
He's
made me
pulling it up,
really,
his sweatshirt up over his face.
yeah, so that I was not breathing raw air temperature, because I know from swimming, it's like, I'm taking a lung volume in of ambient air while I'm in the water. So it's like it's working on me. But then when I'm out afterwards and I've got this distance to, not long, but enough distance to walk, it's like I'm already chilled. And it really feels like this air that I'm breathing in is continuing the chill, because the air temperature might be 40 degrees, or it might be, with wind chill like 32. I'm thinking about what you're talking about, this cold front that just arrived and I think is supposed to last for a while.
Yeah.
Maybe you should experiment. I mean, maybe you already do, I don't know, but experiment with a scarf over your breathing apparatus, because just to take the shock of that below zero air.
Yeah, I always
out of
wear
your
a
lung
neckerchief
load.
anyway.
Yeah. So that's all I wanted to share. If you weren't doing that,
Good tip.
because if it's coming into your lungs and your lungs are oxygenating your blood, it's like you got a main. Yeah.
Yeah. Thank you.
Worth
I
an
appreciate
experiment. Yeah.
That's
Good
great.
luck with it.
Thanks, Carl. And thanks everyone for joining us. You're welcome to stick around here in the live studio audience as soon as we end this episode of Collateral Nation. You can always join our live studio audience. The conversation always continues. Info, INFO at PADhelp.org. Make sure you do send an email. Also, don't forget to like this video. It helps us a lot. Subscribe to the channel. We have great content like this. We have more hangouts happening all day Wednesday. And other great interviews with doctors and clinicians all week long. So don't forget to subscribe to the channel as well. And make sure you check out Fit Old Dog. That is youtube.com/the @Fit Old Dog for amazing videos on how to improve circulation. And maybe you will be competing in a world's half Iron marathon. Ironman. Am I saying this right, Kevin? Half Ironman.
Let me make a comment. Yeah, half Ironman. Let me make a quick comment. I'm very pleased with Marina's atorvastatin experiment. That going off of it made her feel better, because this is called data, and data
Is
is
this what
important.
are you just taunting me?
No, I'm not taunting you. I'm frustrated with people dishing out statins and putting people on statins just because they have diabetes. I mean, one person told me that they were put on a statin because they had diabetes. Their cholesterol was normal. this is a bad idea. So here we have one data point. Well, I have others.
Well, make sure you do check One Step Foods because that's interesting. There's a lead cardiologist that started that, and she has some great information with a new study from Mayo Clinic. So that's worth checking out how naturally you can improve your cholesterol situation with increased fiber, increased soluble fiber, and of course, plant sterols. But make sure they're right for you and talk to your doctor about them. I know with my dad, his cardiologist sent him to a very progressive dietitian who had her PhD, and his cholesterol is back to normal because he discovered he had a cholesterol reabsorption issue, and all he needed to do was poop more, to be frank.
Oh,
So-
well, on that note, we'll finish it.
Have a great week, everyone. We'll see you next week. Make sure to join us every week for these
All
great
right.
discussions.
Thanks again, Kim.
Bye, everyone.
See you folks.
Thanks,
See you.
everyone.